average person out there who is not exposed to a case, is not part of an outbreak, has no symptoms, should not be going for testing. There's of no value.
Asymptomatic patients waiting in lines like these are now being directed to get tested at pharmacies, with up to 60 stores in the province launching COVID testing today. But will these pharmacies be able to meet the level of demand? We're going to find out. I'm joined right now by John Papastergio, pharmacist and associate owner of the Shoppers Drug Mart, which is located at Danforth and Coxwell. This one. Good morning to you, John.
Good morning, Melanie.
Before we begin, I should note that we have reached out to various pharmacies. Not everyone is up and running as they were supposed to be for today, but you are. And I want to get from you first up, how do you make an appointment? Because I think a lot of people are confused as to how to make this happen. So let's run through that.
Yeah, Melanie, best way to do it is still to call the pharmacy. There are some pre-screening questions that the pharmacist will ask. So we want to make sure we're getting the right patients into the pharmacy. Still the best way, call the store. Speak to a pharmacist, they'll get you in.
Okay, so speak to the individual store. And now we're hearing that with the pharmacies, at least with the beginning of the rollout, it's really, again, only asymptomatic patients, but specifically for those who are at sort of high-risk areas or that need to visit loved ones at long-term care home. Can you confirm the parameters here for us?
Yeah, absolutely. So first things first, you have to be asymptomatic. So no symptoms. After that, once you speak to a pharmacist, they'll assess if you're in one of the government predetermined high priority groups. So for example, if you're a traveler, you need to take a flight, or if you work in long-term care, you're going to visit someone in long-term care. So are these specific groups that the patients have to qualify for before they come in. But the key point is you have to be asymptomatic. If you have any symptoms, you got to go to one of the traditional assessment centers.
Okay, so now let's walk through what it's physically going to look like. There is some concern about the safety of people who are just shopping at the pharmacy, people eventually who will want the flu shot versus the COVID test. So what does this all look like?
Yeah, that's a good question. And I think our regular customers, our regular patients should be confident with the fact that that things will be safe. I think most important part, again, is these are asymptomatic patients. Once they make an appointment, they've been screened, they'll come into their scheduled appointment, and they'll come into a counseling room kind of like this here. The pharmacist will greet them, they'll sit down, and then we do an intranasal swab. The room is sterilized after each test. This swab is very, very different than the one that you'll get at most of the assessment centers. It's not the swab that goes almost to your brain. It's just right at the tip of your nose. So it's pretty easy to do. And then the specimen sent off to a lab. Then room gets sterilized, next patient will come in.
Okay, John, what does the wait look like? I know you have to make an appointment, but how frequently are these appointments going to be? Are they back-to-back? Do you anticipate maybe there will be a waiting area, a space indoors or outdoors?
So, yeah, good question. So we're encouraging patients not to come before their predetermined time. Right now, we still have spatial limitations within the store as well. We're allowed about 55 patients or customers within the store. So once a patient arrives, if they're waiting for the pharmacist, there'll be one person waiting in the waiting room. Beyond that, I think we'd encourage them to wait outside. But we're scheduling every 15 minutes or so right now. We don't have much experience with it yet. I mean, this is all starting today, so we hope that pharmacists can get the patients out within about 15 minutes. There has been a lot of demand, so we're getting calls constantly yesterday, the day before. So we're trying to schedule everyone. I think we'll be able to manage the volume.
Okay, John, lastly for you, what does the result turnaround look like versus, doing it at a pharmacy versus doing it at an assessment center?
So it's still going to a provincial lab. So the laboratory kind of analysis time is up to the labs. We expect there'll be a few days to get the results back. Patients with a green health card, they'll be able to check the results online. If anyone were to test positive, the pharmacist in public health will call them directly. Negative tests, you'll be able to check online yourself. If you don't have one of those health cards, a pharmacist will give you a call as well, just to review the results with you.
Okay, John, appreciate all this information on day one. Thank you so much. That is John Papastergio, pharmacist and associate owner of the Shoppers over at Danforth and Coxwell. Good luck to you today and for the months ahead. Thank you for that. And by the way, if you want to check out all the other locations that are available as of today or should be available as of today, go to our website, bttoronto.ca. All right, Frankie, we're over to you.
Hey, good morning. Thanks, Mel, and thanks to all the pharmacists out there that are helping us work through just another stage of this pandemic. Let's talk a little bit about what's going on weather-wise. Kids, it's a Friday.